Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Imagine opening your patient portal and seeing your radiology report before you've had a chance to speak with your healthcare provider. You start reading. No acute findings. Unremarkable. Clinical correlation recommended. Incidental finding. What does any of it actually mean? Radiology reports are written for healthcare professionals, but today more patients than ever have immediate access to them. In this video, we'll walk through how a radiology report is organized, explain some of the most common terms you'll encounter, and help you better understand what you're reading, while also explaining why your healthcare provider is still the best person to interpret what the report means for you. One of the biggest misconceptions is that radiology reports are written directly for patients. In reality, they're professional medical documents designed to communicate detailed imaging findings to the healthcare providers responsible for your care. Radiologists aim to be accurate, consistent, and specific. They often describe exactly what they see, even when those findings may turn out to be completely harmless. This level of detail helps your healthcare team combine the imaging results with your symptoms, medical history, physical examination, laboratory tests, and any previous imaging. The report is an important piece of the puzzle, but it's rarely the entire picture. Although reports vary slightly between hospitals and imaging centers, most follow a similar format. The examination section identifies the type of imaging that was performed. Clinical history explains why the study was requested. Technique briefly describes how the examination was completed. The findings section contains the radiologist's detailed observations, often organized by body part or organ system. Finally, the impression summarizes the key conclusions and answers the clinical question whenever possible. Many healthcare providers begin by reading the impression, then review the detailed findings for additional context. Medical terminology can sound intimidating, but many commonly used words are simply descriptive. Unremarkable generally means that the structure being described appears normal on that imaging examination. No acute findings means there is no evidence of a new or urgent abnormality that requires immediate attention. Incidental finding describes something discovered unexpectedly while looking for something else. Many incidental findings are harmless, but some may require follow-up depending on the situation. Lesion simply means an area that looks different from the surrounding tissue. A lesion can have many causes and does not automatically mean cancer. Nodule refers to a small lump or rounded area seen on imaging. Many nodules are benign, while others may need additional evaluation based on their size, appearance, and your individual risk factors. Opacity is often used on chest imaging to describe an area that appears denser than expected. It is a description, not a diagnosis, and can have many different causes. These words help radiologists communicate precisely, but they don't provide the full clinical story on their own. Medical images don't exist in isolation. The same imaging finding can have different meanings depending on the person's age, symptoms, medical history, and the reason the examination was ordered. A small finding that is completely expected in one patient may deserve closer attention in another. That's why radiologists value the clinical history provided on the imaging request, and why your healthcare provider combines the report with everything else they know about your health before making recommendations. You may occasionally read phrases such as recommend follow-up imaging, further evaluation suggested, clinical correlation recommended. These statements don't necessarily mean something serious has been found. Sometimes one imaging examination raises a question that another imaging modality can answer more clearly. Other times, a follow-up study is recommended simply to confirm that a finding remains stable over time. Medicine often works by gathering information step by step, rather than reaching every answer from a single examination. It can be tempting to search every unfamiliar word in your report online. The challenge is that many medical terms describe a wide range of possibilities, from completely normal variations to more serious conditions. Without knowing your symptoms, history, physical examination, laboratory results, and the rest of your report, online searches can easily create unnecessary anxiety. Reliable educational resources can be helpful, but your healthcare provider is the best person to explain what your specific report means for you. If you've read your report and still have questions, consider asking, what was the main finding? Did the imaging answer the original clinical question? Do I need additional testing? Are any follow-up appointments recommended? Were there any incidental findings that need monitoring? These conversations can help you better understand your results and what happens next. Radiology reports are an essential part of modern healthcare, but they're written using precise medical language to communicate between healthcare professionals. Understanding some of the common terms can help make your report feel less intimidating, But it's important to remember that every report must be interpreted within the context of your overall health. If you ever have questions about your imaging results, don't hesitate to discuss them with your healthcare provider. Thank you for watching in the No Medical Imaging, where we make medical imaging easy to understand. If you found this video helpful, please like, subscribe, and share it with someone who has ever opened a radiology report and wondered what it all meant. We'll see you in the next video.